Well, good day. This is another in the series I'm calling Reflections from Pharmacy Leaders Advancing the Profession. It is my pleasure today to have with us Dr. William Miller, who's a professor emeritus at the University of Iowa. He is a nationally recognized expert in pharmacy leadership and residency programs. He's been a clinical pharmacist, author, educator, mentor, and leader for a number of years. And this year, 2020, was recognized with the Harvey Whitney Lecture Award from ASHP. He is a past president of AACP, the American Association of Colleges of Pharmacy. And the thing I remember about his presidency was the commission to implement change in pharmacy education, which to me was very significant in advancing our profession. And he's also a past president of ACCP. He's received the Paul Parker Medal from ACCP and also been recognized as a distinguished educator. So it's my pleasure to have with us Dr. Miller. All right. Okay, we'll start off with what we would like to learn more about your journey to your leadership position, to your recognition as a leader. And in that response, you can maybe comment about key events, key turning points, or persons who influence you in that journey.
Okay, it's a pleasure for me to have this opportunity. This first question about
no sound here. Try again.
Oh, there's no sound on.
Oh, now we got it. Now we got it. Okay. We're good.
All right. The question about the journey to become a leader. Reflecting on this, I think when you're a student in high school or even a student in college in your entry years, probably there are some students, but my guess would be that most students don't think they're going to become a leader. I don't even think they think that they will become a manager, at least in high school. So this is not something that starts early in most individuals' lives. And for me, it started with my family. My family being, I have two sisters and a brother. My brother is a pharmacist. I didn't want to be a pharmacist because he was a pharmacist, but I ended up that road and that journey. My brother, Russell Miller, was interested in libraries. He's a librarian. He's a pharmacist and a librarian, and he started the Pharmacotherapy Journal. And he encouraged me quickly to go into pharmacy. Went into pharmacy first year, and then he said, well, you know, there's a new place called the University of Kentucky Medical Center, and you should go there. So I went there as an intern for the summer, and I met a gentleman called Paul Parker, and you referenced the Paul Parker Medal. Paul Parker was an exceptional leader nationally, and he told me to go on and do the baccalaureate degree at that time at Ohio State University and to pursue hospital pharmacy. I did that. I was a shy person, rarely spoke up, and I ended up with my next mentor, Cliff Lachelet, at the Ohio State University. So at the point I want to make is these journeys are often not planned. These are things that happen because of the interfaces and people that you interact with in your life. It can be your family, it can be a friend, it can be a job position that you're in, that you meet someone that is a leader. I also want to say that when we talk about leadership, we're often we think of principal leaders that are over organizations like a dean of a college of pharmacy. We have the silent leader, the a leader who is an individual. All of us lead. And what's changing now in pharmacy is the leadership is not like the director. The director of pharmacy in a hospital has to be a leader. But what's changing pharmacy is the individuals on the front line that are working on teams. So I think sometimes these terms of leadership and managers are kind of maybe overstated, and people don't see themselves as being leaders when they really are. So that's part of my journey. From there, I had the opportunity to be an associate director at Ohio State. And from there, I went on to the University of Tennessee, Medical University of South Carolina, and the University of Iowa. And I was kind of, in the pharmacy profession, in the 70s and so forth, kind of the practice part of pharmacy became more emphasized. So because of my leadership in developing services, I've got very much involved with ASHP, and I got nominated to be a member to go for an office at the ACP. And through that, then I've made a lot of contacts, and you referenced in your opening the commission to implement change in pharmacy. So I've just been blessed, but it's been just opportunities that have come along to me by others.
Very good. That's great. So one of the other question I have is, what do you think will be your legacy in 20, 30 years? And I paraphrase that question to ask, reflecting on your contributions to help advance the pharmacy profession, what are you most proud of?
Well, I would first say that each of us are individuals, and how we become leaders is driven to some extent by some of our attributes, which come from your parents. And one of mine was that whatever you do it the best you can do. And so I've been some people think that I'm too assertive, but I have pushed for excellence in anything I'm involved with. I'm relentless about excellence. And so, and it's just part of my makeup. So excellence. And so that led me to, in all the things I've been involved with, today's term would be progressive. I embrace change, embrace improvement. So my opportunity at the American Association of Colleges of Pharmacy I was a student. In fact, I left a job because the College of Pharmacy that I was at was not really receptive to clinical pharmacists being faculty. And so I didn't feel that I could accomplish and do the things that I felt I needed to do. So and there's a number of people with me, probably 5 or 6 of us, that really pushed integrating into AACP. I could go back and talk the history of past presidents that helped make that happen. And so my theme was on changing the role of pharmacists through education. And so that was the commission to implement change. One point there I believe was important. I believe that the best outcomes come when you have a diverse group of people working on something. I appointed people, about half the people who were against the movement to the PharmD as a single degree, and the other half for it. And they worked it actually was extended to over 2 years to work this out, and the papers that they produced have had, I think, a significant impact. I'd say the other thing as far as accomplishments is I believe this goes back to the University of Kentucky. When I was there in the early 70s, Paul Parker had 8 residents. And we followed the medical model. Pharmacists were clinicians. And to be essential, you have to provide a service on a consistent basis. So having people coming in and out, that's nice when we have them there, the physicians would say, but they're not essential because 4 out of 5 days a week, or just an example, they're not there. So I've pushed, again, back to my trade of winning excellence, comprehensive pharmacy services. At the Medical University of South Carolina, when I went there, we ended up with 23, I believe, residents in all of the areas. And at that time, it was, I think, the top number programs in the country. Now we have many that are in the 20s, some in the 30s. So postgraduate medical education, postgraduate pharmacy education, I should say, is where we're going. We see that now with the number of students that are doing PGY1 programs, and the big growth is in the specialty areas. So I think I had an influence on moving that along. I'd say those 2 things.
Very good. Thank you very much. So the next question is advice for students in their journey to develop as leaders.
I would say, I was thinking about this just briefly, one of the problems we've had in pharmacy is our curriculums are so tight that we don't give students opportunities to explore other parts of pharmacy. For example, a leadership course. They may get some component of that in a course, or even rotations that are leadership or management. So I encourage the students, it's not just diversity. I know there's a lot of discussion now about the social sciences, and I'm totally supportive of that, about the people part of being a pharmacist. If we're going to be successful in expanding patient care in community settings, the characteristics that are so important are the human characteristics as well as the knowledge. And so I would just say schools, encourage schools to provide those opportunities, the other to students, but for students to do other things in their curriculum using electives. I'd also say, work in different settings. If you move from a hospital setting, community, you can do that with your electives, APEs, and so forth, to see things that you might be interested in that would really be your dreams for your life. So
That's great.
That's helpful.
Yeah, that's wonderful. Thank you very much, Bill. And the final question has to do, this is a history course, so as we study the decade of the 2020s, one of the key events in that decade will be the COVID-19 pandemic. Like other events in history, it shapes our profession, and we can look at that as we study history of our profession. So how do you see that being described as being an opportunity for the pharmacy profession? In other words, what is it going to be written about this decade?
Well, the big part of this is community pharmacy. This is the big change we have to make. Mm-hmm. And the hospitals are not all of them, but a lot of them are very progressive. In the community world, we have to change things. And I think when we look back at history, one of the biggest changes is something simple, and that was immunizations. I was in Iowa. The board of medical for the state opposed it because pharmacists, they were afraid that pharmacists would take on a significant patient care role. Luckily, they had the person over that for Iowa. So the bigger thing is more patients would get immunized because they come into the pharmacy. And so what we see today is patients coming in for not only that, but other things. And they don't care. They just want the quality, they want to get their health care. They can just as easily sit in a community pharmacy in a chair as they can in a medical office. And so now I think one of the big things with COVID is the change, and an area that we need to concentrate on is public health. It doesn't mean we need to train people to be public health specialists. All of them don't need to do a master's in that or something. But they need to understand a lot about
Okay, the connection. Oh, sorry. Okay, there's some background noise. Maybe repeat back the last couple of sentences.
So I think thing we need to do is keep on developing patient care services. Provider status is a big part of that, and the professions behind that. And as we see more things, things like this, the fact now that in some states they're allowed to do COVID testing, that's occurring. These are recognizing, Congress and other groups, that these pharmacists are all out there and they're a resource. So I think that's going to help transition pharmacy. The two things that I would say as far as closing are the major things that we need to do is to change practice in the community, but to think of pharmacy as one. Pharmacy is one. And what I mean by that is the connections. Community pharmacies are going to be more connected to hospitals, transitions of care. That's going to position us in a place to be able to provide overall management in a collegial way with our different parts of pharmacy and with physicians. So establishing interdisciplinary teams with pharmacists a part of them in the community would rock, if you will, a change in pharmacy.
Very good. Thank you very much, Dr. Miller. It's been a pleasure.